Ladies and gentlemen, uh, I am rather honored to be over here for a very important cause. The cause is aging. So most of the time, this is the stage of the life to which we rather worry about. As and when we are, let's say, from the middle age going to the old age, so worry about what will happen thereafter. Especially maybe in the developing countries, or maybe where the people are, especially the old age people, they are less privileged. See, this is one of the important area in the developed countries, as well as in the underdeveloped countries or developing countries, but little is being done. So I think this is very, very important in the present day scenario because of the fact I will just highlight what are the various things which need to be taken care of as far as the longevity and the good quality of the health. So I'm Dr. Suresh Bansal. I'm from PGI. Basically, my maximum training was from PGI only. So I after doing my residency program, junior residency, did senior residency in neurology, and thereafter I was a faculty member over there before taking up a premature retirement in somewhere in 1995. Now I'm the self-employed and do take care of all the neurological illness, clinical neurologist, neuroelectrophysiologist and behavioral neurologist. See, the Indian Association of Age Management, we are the part of the NGO. See, we are part of the big pool, sometime unknown and sometime known, but everyone, all of us, we need to be reckoned. So here we are. We start inception in 2009. And this was by the, I'll say, a very great person, dedicated person, our patron, Professor V.P. Bansal, who happened to be Director General of Health Service of India. So over the decade, there's a lot of activity which has been done silently, actively also at the urban level, rural level, at the grassroots level, as far as the coming to the conference, this is our first conference, we have taken up the process of healthy aging. So aging can be healthy. So what is the healthy aging? So this is the concept we are imagining. And ultimately, what are we imagining or what are we hoping with? 70-year-old person looking like 50 years? Or maybe 80 years old person behaving like 60 years, mentally, physically, emotionally, socially, or maybe financially, in every respect, in all walk of life, without any sort of empathy or without any sort of favor, just like having one's own self-esteem as well as prestige and good go with self-respect in the family, in the society, and at the country level. You see, what are the parameters on the basis of which this healthy aging has been defined? What are the determinants? So the determinant was about 10 determinants which has been put forth by the WHO. The work was done something before the healthy aging decade. This is the healthy aging decade is going on from 21 to 30. The 10 determinants are, they are based on social factors, mental factor, physical factor, and there is overlap. So I'm not going to go into detail, but I'll go from center to periphery. The most important thing is the outlook, the attitude. See, attitude is our tag. It's our price tag, our recognition tag, as our identity tag, because that's what we live for. This may be ego, self-respect, identity, or our movement is concerned, with a good go. So, community engagement, self-awareness. See, we have to be conscious. So, what is consciousness is the self-awareness. And of course, so many other tags related with that. Good physical activity, transportation, locomotion, maintaining the center of gravity, and so many other things. Social sport, very important. Family sport, especially in India, we are having a good family system, but still it's going heavy in the recent times. Financial security is very important, and then the independence. So on these criteria, these are the determinants. What is the healthy aging? Are we aging? Maybe looking, people say me, maybe compliment, I'm going to start the 76 years, but do I look like? I don't know. What is more important is there has to be healthy, not only the physical body, the mental go, and as well as the various aspect of memory, cognition, everything. So there is a demographic shift, and that's the important thing. Most of us, not only the NGO, the government, and so many other things, they have to recognize ultimately. Maybe this small gathering, it has to be big gathering. The hospital may be full very soon. There is going to be dedicated old age hospitals. You know why? There's a good demographic shift. This is not only in India, this is world over. I'm presenting the data from the United Nations Population Fund. So this is what is happening. This is the developing country and developed country. Now this is the gray is the developed country. This is the 1 century data. And see the developing country. In which way the population, old age population increasing. So we have to see what is the old age. 60, 65, 80, 85. This depends from country to country. There are certain countries who are defining 85 as the senior citizen or the old age. But most of the time it's the 65 year. So what is the scenario as far as the India is concerned? See this. It is the Government of India, Ministry of Statistics. This is again almost a century. This is the as far as the children are concerned. And this is what is happening as far as the old age is concerned. It's almost going from 6% to 12%. Very soon, maybe in another few years, by 2030 or maybe 32. That's a cause of concern. Because there are so many things which is not there, is there now. What was there in the past, the respect in the family, there was a lot of hand holding, there was so much empathy as far as the old age guys is concerned, that is lacking. So that's why it is very important to take care. I'm not touching why this is because of the decreased infant mortality rate, or this is because of the increased longevity of life. Longevity doesn't mean good quality. So this is why I'm talking to you, even the developed countries like states, where there is especially the females, the longevity, maybe the average age expectancy is 84, 85. But what about their mental age? So all those persons who are above 80 years of old in America, 20 to 25% of them, they are having significant quantum of memory deficits, dementia. So what does this lead to as far as the old age is concerned? So I'll come one by one. What is happening in India? You see, good number of old age, we are sitting over here talking big and we are promising big, doing so many other things. But what about the less privileged countryside people? Dalits, poorest of the poor. So I'm not over here to define what is poverty and what is not. But one thing is pretty sure. The old age is, especially in the rural area, is one of the things which is creating lot of problem for their oneself, which need to be taken, because they are also again human being. They are as good as the urbanites. They are as good as the cognitive function is concerned, So what are the challenges? Socio-economic, cultural, educational, there is diversity. As far as the need is concerned, as far as the luxury item is concerned, as far as the other aspect of the living is concerned, as far as the desires and need definition is concerned, most of these persons, as far as our urbanites, is marginalized. See, changing lifestyle is one of the very important. What is happening? Everybody is on the digital media. I'll say most of the time we are in the digital media, one or the other type. It's okay to be more informed. You see, Google Guru is, if I'm going to talk about the library, the first library was in Alexandria, something like in the 6th century. But what is happening now? The Google library is possibly the best. So it's okay to be with the different type of updates one wants. But at the same time, as far as the social trends is concerned, they are going heavy. There are a lot of hurry, worry and curry. See, curry means obesity. Curry means so many, despite of having everything, not having a balanced diet. There is a generation gap. I always say this. And this is very, very important. Old guys, they are having a lot of horizontal knowledge. And as far as the youngsters are concerned, they are having a lot of vertical knowledge. So where are we from? As far as India is concerned, we have seen the system about three decades before nuclear, then joined to nuclear, and then there is a loneliness. Presently, loneliness is creating a lot of problems. See, loneliness is of different type. This can be because of loss of one partner. This can be maybe because of some sort of abuse. I do not want to go into this solitude and what is the difference between all those things. But there is a big thing which one can say about the loneliness, but loneliness kills. This is what the WHO data is. I'll come to it into detail in my lecture of the aging brain. Health. There are different issues. There are some common issues, and there are some different issues as far as the individual take is concerned. Immunity is at heavy. That's why, as far as the immunological disorder is concerned, they are seen more in children or maybe in the bipolar in the old age. This is what we have seen in the COVID also. So there is a fragility, the purpose. Sometimes the old guys, they don't have purpose. I think we all are having purpose. Old guys must be rehabilitated. They must be made. So I'll say that a person who is engineer, an architect, or anyone who is maybe in a community living in the old age home is worth of it. His knowledge can be of immense use as far as the youngsters are concerned. Even a one lecture of 2 hours, 3 hours is good enough, which should be planned in that way. They should be rehabilitated. I'm not saying the rehabilitation has to be just like in Japan. People are just running at the age of 100 years. That's of course very good. So I did tell you as far as the dementia is concerned, this sets in. This is one of the very important things. Finance, legal thing. See, people in the old age, they are getting abused. Over and above the isolation, they are getting abused. There are different type of abuse. Even physical abuse is there. Maybe by the family members themselves, or maybe by the society, or maybe so-called we talk very high, but there is a mismatch as far as the demand supply is concerned. There is assault, as I have written, 6% of persons. What are the common age diseases? So the common age diseases, as far as the low income country is concerned and the high income. So the high income is below, light gray, or maybe this is green. Green is the developing country. See the heart problem. I'm going to take these four bars. This is the muscle respiration. These are the vital organs, basically the heart, lung, and brain. They all three are very much affected, along with mitosis, cancer. So this need to be checked. Of course, the other thing also need to be checked, but this has to be focused, and they can be checked. Surely they can be checked for better. The quality can be improved, and they can be checked well in time. What are the things which is going to lead to all these things? This is the cup of or the thought of the day. Another important thing is concerned we are discussing, but at the same time we must listen to the voices of the older people. What matters most to them? See, I'll say, all said and done, the thoughts and emotions they prop in simultaneously. They play, dance together throughout our life. And I've seen visiting the old age homes, again, they live in emotions. So talking with them, they will say, I want to go home. Why they want to go home? Because they want to meet to their grandson. Because that's what the emotions play more role. Of course, I'm saying thoughts and emotions go hand in hand. But at the same time, ultimately, emotions which are more important. So, are we late? There has to be a lot of things like advocacy, awareness. People are not aware. What are the various facilities which is available? They are not aware of what is metabolic syndrome. We are becoming the diabetes capital as far as the India is concerned. Obesity is another big problem. There are so many other things which is not can be checked, but we are not fully aware of that. Planning is very important. As we plan for after the retirement. Otherwise, after retirement, I have seen people who do not have any sort of planning. They create a problem for themselves. Their life is shortened. Even, I'll say, even losing one partner, the other person, if not having any sort of objective, clear objective of living is going to have problems. So I'll say all these things is more like a stitch in time or make the hay when sun shines. Active intervention, social support system, palliative treatment is very important. Discuss at length. Domiciliary treatment, again, it has been proved Domiciliary treatment, especially in developing countries like India, where family system is very strong, the domiciliary care is far, far better than those who are in old age homes in the developed countries. But this is also getting diluted as far as India is concerned. The medical therapy is again important. Resource, and you see, there is a demand and supply. We may be having some resource, but are they being utilized properly? So I may be having 100 rupees in my pocket, and I have to have the economy of, I have to value the money. So value of the money and other things, this is very important, in which way this has to be done. So the work task. As far as the empathy is concerned, that's okay, but one need to have a compassion. One need to have a resilience to provide the best possible at individual level, at collective level, at the social level. Organizations and agencies alone, government cannot do this. Believe me, they cannot do this. And there are agencies, there are different type of NGOs, one being ours. We are putting our own worth. India is having roughly 28 old homes. There are different type of old age homes, different type of services are being provided. There are some without any no profit basis. There are certain even corporate type of old age homes are coming in. They are having some studio apartments. They are having even community living, and so that's okay. Those whosoever can afford. But at the same time, I talked about those who are less privileged and in the rural background. I'm very happy to see the work of HelpAge India. One of the speaker, Dr. Ritu, she's the mission head of the medical services of HelpAge India, is sitting among us. So this is the picture of the pie diagram which I have taken from their just happened the annual report. See how much they are doing: health, social protection, disaster management, aged care program, and this NGO is for the last 4 decades. They are doing meaningful work. As far as the meeting highlight is concerned, there are various speakers. See, as far as the old age is concerned, this need to be addressed by the various specialties. They behave differently. Believe me, I have seen so many patients who are in old age. Their behavior as far as the infection is concerned is totally different. They may not have fever. They may not having a patient of mine doing regular walk of 4 to 5 kilometers to the lake as far as the Chandigarh is concerned was suddenly deteriorated. I did talk simple investigation like TLC, DLC, which was overlooked by the family, and we lost the patient. So the infection behaved totally different because of the borderline immunity and because of the other things. So what more important is that various specialties need to be taken care of, which is going to be important as far as geriatrics is concerned. You see, there was a time when we were not having many geriatricians. This was the time, this was maybe in some Madras University or maybe in AIMS or certain other areas. Even there is no given dedicated geriatric unit. This needs to be there. So there are many specialists who is going to talk about the aging and in which way their heart and other things is going to be affected. Thank you very much for good hearing, nice hearing. Thanks a lot.